Good morning, this is Richard. I'm your clinical coordinator here. I just wanted to talk to you guys a little bit today about documentation for coronavirus. I know there's been a lot of changes recently, and the QA department has been asking a lot. So the first thing I want to do is thank you for being diligent and for being really flexible with this as we go through this pandemic together. We're learning a lot, and we're trying to put the tools and the resources out there that you guys need. So again, thank you for doing that. I guess first we should talk about why we're asking for all this stuff in the QA department. Retroactively, we want to be able to go back and look at how the pandemic unfolded and how we responded. This is going to be a great learning tool for future pandemics to come and for setting up our response and our treatments going forward. So let's get it out right out the way, what we're asking. So mandatory, we're asking everyone gets the page 8 questionnaire. And this really puts you in the mindset of screening all of your patients for COVID. And when I mean all, I want to clarify all patients. So we're talking your discharges, we're talking fractured ankles. If you can get a history on scene, we're also asking for cardiac arrests and DOSs. So any and all patients that fall into any category, we're asking that you use that COVID screening questionnaire on page 8, and I will show you exactly how to find it. So I'm going to start sharing my screen now, and we're going to go through a chart together, and we're going to have a good look at all of the areas where we're asking for documentation to be done on these COVID patients, okay? So here's a test chart, and this is the entire chart view. I'm going to go through page by page all the areas that we're asking you to fill out COVID questionnaires. Now, the actual questionnaire itself is on page 8, and that refers to every patient that we're encountering. So let's go ahead and knock that one out of the way, okay? So we'll go to page 8, and here you have a list of all the interventions that you did. And of course, this is a test chart, so I don't have any real interventions. But let's go ahead and look at the add vitals area, okay? So was at a time, let's say at 1900. We'll go ahead and have our vital signs, cardiac monitoring, and all that. Where we're asking you to fill out this questionnaire is here on the Add Action line. So go ahead and open up Add Action, and we're going to the Assessments tab. Once you hit the Assessment tab and you hit Save, a pop-up menu will come up. And here we have your Action and Assessments log. So we're going to ask you to go over here to the Actions area, and we're going to have you select Infectious Exposure. When you do that, the questionnaire will pop up. And this is a series, this is actually 8 questions, and they're all pertinent to things that we're assuming at this time that the CDC wants us to, well, we're not assuming, they're actually giving us the guidelines to be asking and screening our patients. And the reason this is important is this is pretty much the equivalent of when you go to the hospital, when you go to a clinic, they take your temperature and then they ask you a series of questions, and then you'll be allowed in or you'll be told to stay outside because you could potentially be infecting persons. We really don't have that option in EMS, but what we do have is the screening questionnaire. Okay, so here's a little drop-down menus here to answer yes and no for these questions that they have. Yes and no, travel history, contact with persons with flu-like symptoms or COVID itself, fever and cough in the past 30 days, and of course you have the other symptoms that go along with it. Once you answer yes to all of those questions, or whatever the actual answer is, and as best you can to fill in those answers, go ahead and submit it, and it'll log it on your activity log. Okay. All right. So let's go over some of the other areas where COVID is going to be required for documentation. And I guess before we do that, we should talk about some of the signs and symptoms that are giving us red flags when we start thinking about COVID. So fever, shortness of breath, and cough, of course, are going to be the mainstays of someone with pretty advanced COVID. But we're also seeing that the patients are presenting with different symptomologies. So the CDC has broadened their symptoms that they're asking for us to be screening for. So fever and chills, of course. Other ones are going to be things like muscle pains, headache, sore throat, GI upset, diarrhea, and chest pains. So if you have any of these patients that have any of these symptoms, go ahead and start thinking in the back of your mind, hey, maybe this is a candidate for coronavirus, or they have COVID-19, and so document accordingly, okay? So let's go through the chart here. On page 1, there's really not any areas here that you need specifically to be paying attention to or to be documenting for coronavirus, unless you're on Medic 51, our infectious disease response unit. If that's the case, then over here under specialty information, we have a team selection here. And you'll see that we have the option for infectious disease response unit. And again, that's only if you're on Medic 51, you're specially assigned to a coronavirus patient, you'll be documenting there, okay? The patient demographics, again, not too much going on here. We'll go to page 2 instead. So there's a lot going on here on page 2 that we're asking for your coronavirus rollout. So let's go ahead and get started. The first one is going to be impressions, okay? So you have your system, your symptoms, and your impression. Here we have some impressions that directly relate to coronavirus that have just recently been added. So you have 3 options here when it comes to coronavirus. Number 1 is concern ruled out. So you've done your questionnaire, you've done your full assessment on the patient, you've got a good history, and you are not really concerned for coronavirus on this patient, probably because they just fell and they broke their ankle. Your second option is coronavirus other as caused and confirmed by testing. So these are patients that have actually had a coronavirus test, they've been screened at a facility, and they've gotten the results back, and yes, this is a positive coronavirus patient. So that's going to be the one you select in that case. The third option here is going to be suspected or exposure to confirmed case. And we're really expecting most people to fall under this category here of suspected or exposure. So a lot of persons now, as the caseload goes up, a lot more people are being exposed to people with confirmed cases. So be utilizing this one as probably your main one, unless, of course, they've been the concern ruled out or you haven't been it has been confirmed by testing. Okay, so go and select one of the 3 of those when you're doing your assessments on your patients. The next area that we're asking for is your Als Assessment Rationale. And so this one here is going to be typically your rule outs when you're dealing with your patient interactions. Not only that, but the reason why an ALS provider was selected for this transport. Not necessarily the reason why you were sent if you were just picked, but if there's anything going on like cardiac monitoring, sepsis, vitals and fluid monitoring, and then of course the things that you're ruling out. So typical rollout would be things for like rule out pneumonia, rule out sepsis, but now that we have coronavirus, we do have to have that concern. So we're asking that you do in your assessment, ALS assessment rationale, a rule out of COVID when you have a patient that you suspect may have symptoms similar to what we discussed earlier, those 6 symptoms, and things along like that, okay? So keep in mind that's what that area is there for, and if we're asking you what you're putting in your ALS assessment, that's the area in specific that we're talking about, okay? The second area is your HPI. So here I have the HPI in front of me, and of course this chart is a test chart, so it doesn't have the exact HPI that we're looking for. But here, go ahead and paint the picture. Put anything in here that gives you the impression that, hey, possibly this patient may have been exposed to someone with coronavirus. Maybe they've traveled recently and you want to put it in there that, you know, this person has a high level of suspicion for me that they may be, that their symptoms may be related to coronavirus. This would be the place to put it, okay? As outlined here, you can put your PPE use and your response. You can put any type of exposure that you may have had happen, just written out here in a dialogue kind of format. And those are the kind of things we're asking for in your HPI, on top of just the reason why the 911 call was placed in the first place and all the events that led up to here. So that's kind of what we're expecting here in the HPI. The next area that's kind of new that we're looking for everyone to be filling out when they do have a suspected COVID patient is here under scene description, and it's a button that says exposure. And when you click on this, it comes up and you select a crew member. And what we're using this for is to document the level of PPE that you guys are using out in the field. So the standard precautions are now, of course, face mask for everyone and gloves. But if you have a patient that has, you know, severe respiratory issues, maybe they're pulling fever, and you have something in the back of your mind making you think, hey, this is a possible coronavirus patient, then you should be donning your heavy PPE. So you have your N95s, I'll go and pull it up, your N95 masks, your gowns, your gloves, any face shields or eye protection that you may have used throughout this call. And of course, if you do have something, you know, like a PAPR or a shoe covers or bouffant, you can also document it here. this we want to keep a log on our medics, just to make sure that you guys are doing, your full PPE anytime you think you may have a coronavirus patient. And this just logs it and shows that you guys were doing your due diligence. And suspected injury exposure, it should be no if you're wearing your PPE, unless you do, for some reason, I don't know, rip your mask apart and then someone coughs in your face, then you'd be suspected injury exposure. But otherwise, that's simply not the case here. Okay, and then the last part, again, we just did it already. We did it initially. It was that page 8 screening tool. Okay, so let me clarify again. Every patient in all scenarios and all cases will get this page 8 assessment. So remember, you find it by going to your, adding a vital, and you go to add action down here, assessments, save and add. We'll probably have to take our time. And then you go to action, infectious exposure, and then you have the questionnaire pop up right there. So all patients are going to get this one. We're going to be asking going forward that all patients have this questionnaire filled out and that all of the questions to the best of your ability are answered. Okay. Guys, that's really it. Just those areas, page 2 and page 8, as far as your documentation goes on any and all these patients that you're suspected of having coronavirus, but page 8 specifically for all patients is what we're asking for. Okay, that's our screening tool. That's what we're using to make sure that we're asking all of our patients and screening them appropriately, because right now it is pretty widespread, and the symptoms are something that if you're not on your guard, then you can end up missing. So please pay really close attention to that. Again, I want to thank you for being diligent and for being flexible with this. We're all learning together, and so if something changes in the coming weeks, we'll be sure to get the information out to you. And just please be responding to your QA flags. That's pretty much it. Guys, just take care of yourselves out there, wash your hands, don't touch your face, and we'll get through this together. Take it easy.